Then also different side effects on skin. You may see the skin may peel off a little. Patient may have diarrhea. The bladder, if it's bladder, the patient may be having frequency means the patient goes to toilet very often, and the hair may be lost. Then mucositis, that's the mouth may be peeling, like majata, that man. Yeah. So also we have other things, hormones that we use to treat cancers and immunotherapy. What the hormones does is that there are some cancers that need hormones to grow. So what you do is, next slide. Those cancers that need hormones to go, usually the breast and prostate, that's what you use. That's why the testicles produce the hormones. So that's why some people, they just tell them to remove their testicles. They just remove the 2 testicles. That's the cheaper option. However, there are drugs that can be given that will do the same work of removing those hormones, but you have to take them continuously. They are very expensive. So usually removing those testicles is a cheap way of removing the hormones from the body, where they are. You can either block the production of the hormone by removing the source, or block the action, or make the cells unable to sense those hormones. Then there's something called targeted therapy. Now, hormonal therapy is usually relatively less expensive, but targeted therapy are usually very nice, but very, very expensive. But both hormonal therapy and targeted therapy, they generally have a better side effect profile. Their side effects are usually relatively mild compared to chemotherapy and radiotherapy. However, the problem is that you hardly can use them alone to treat the patient, especially targeted therapy. Targeted therapy, you almost never use them alone. You have to use it along with chemo to make them much more effective. I don't think we can go to details of examples. Next slide. Next slide. So now another one is cancer immunotherapy. You remember what I said, that even when cancers form, usually the body has a way of immune cells that go around the body, kills the cancer cells. Now, usually also the body has a way of regulating these immune cells so that they don't do schedule, so that they don't overwork. So basically what you do is that in immune therapy is that either the body's mechanisms that tames the immune system, that doesn't make it go overboard, that doesn't make it go ahead, you remove it. It's like you remove the brakes from the immune system so that the immune system now overworks and kills the cancer cells, because it's become so hyperactive that it kills all the cancer cells. You understand? However, the problem with this is that as it's killing the cancer cells also, is that side effects, and it starts affecting normal cells too. So it's like the patient is killing the cancer cells, but it's like you're having autoimmune diseases too. I don't know whether that's you can just browse autoimmune disease. You understand what I'm talking about. So it's not without the side effect, but some of these things can be extremely well effective, even in patients with very advanced tumors. You can see this picture below. You see this big black dots on top is the head. You can see all these black dots all over the body are metastases. The tumor has spread all over the body. After immunotherapy, you can see that it's just concentrated in the heart, the head, and the bladder. Those are normal places where it's in. So it's almost destroyed all the tumor in the body. That's what allows you to keep Carter alive. The former president of the US, he had stage 4 melanomas, but he had immunotherapy, the thing cleared them, keep alive. So they could be very, very effective, but they also can have very serious side effects. They can have hypophysitis. The central place in the body is inside the brain, behind the nose, where most of the hormones of the body are produced and generated. It can affect it, and the person will now have multiple endocrine diseases. So it's not without the side effect, but it can be very, very effective. In fact, it's very useful it's becoming very useful in more and more cancers, like breast cancers and colon cancers also. But the problem is that, I said that immunohistochemistry that I said, you have to test the cancer to make sure it's the kind of cancer that it will be effective in that is done. So many of these, to provide effective cancer care, you can't go and do it in one corner hospital. It has to be a proper, very good hospital. that are doing it that has multiple disciplines that know their onions. Another question. Sorry, I said another question. Another slide, please. Another slide. I know we are almost finished. Another slide. Next slide. Hello? Yeah. So cancer, to prevent cancers, the first thing is stop smoking and taking alcohol. The next one is for Igbo people. Avoid excessive sun exposure. We have enough melanin. Eat a healthy diet. Healthy diet means avoid non-processed foods and take other things in moderation. Generally, if one is moderate in everything, there's no problem. One doesn't have any problems. Exercise most days of the week. I will answer a question someone said about how lethargy causes cancer. Maintain a healthy weight, schedule cancer screening exams. Now, cancer screening exams are extremely important. These pictures I put are actually by pictures. There are three. Now, this is a man that just came for a normal screening colonoscopy. Now, everybody above 45 should go and have a screening colonoscopy. This man is I think he's 62-year-old man that came for a screening colonoscopy. He had absolutely no symptoms. He was completely fine. He was just doing a medical checkup. And we found 5 polyps. Now, these are the things that these have already started becoming cancers when we started histology. But we were able to remove it. He avoided surgery. He didn't need any chemo or anything treatment. These were already on the way to becoming cancers. These 3. The 2 others were still. We removed 5 polyps in him that were already. This last one, if he had waited for like 6 months, he would have come down with colon cancer. But alhamdulillah, we removed it. It was just moderate dysplasia that it was. Just 1 step away from becoming cancer already. So please try to have schedule your cancer screening examinations. Ladies above, once you are 40, make sure you do your yearly or other yearly mammograms, do your breast examinations. Then ask the doctor about immunizations. Immunization like HPV, very common cancer is cervical cancer. Like, I prevent it with HPV vaccination for young people, HBV, for instance, hepatitis B, hepatitis C. I don't think hepatitis C still has the vaccine yet. I'm not sure. But hepatitis B causes a lot of liver cancers, which is very, very difficult to treat. Having those immunizations can prevent quite a lot of the cancers we have. So once we live healthy lives, as I said, even living the healthiest life, one can still develop cancer. So we just pray that not to have them. But whenever we have them, the earlier one presents to a proper hospital for proper treatment, the better. So that's about cancer causes, management, and prevention. I think that's the last line, I think. I'm sorry for making it a bit longer than it should. Sorry. Now, I think that's the last slide, isn't it? Conclusion, I think there's just a conclusion slide. Cancer is not necessarily a death sentence. If you catch it early, it can be very effectively treated. Yeah. So early detection, best prognostic path. So thank you very much, Jazakallah khairan, for the opportunity to share this.
Thank you so much, Jazakallah khairan, Dr. Sharif. Well, I think everybody enjoyed it. When we said we were going to extend the time, nobody left. We actually had more people joining. Then I want to remind you that we're also streaming this on Facebook. Before we end the program, we'll be sharing a Google form in the chats. We want to get your feedback. Like I said, this is our first webinar. We'll be having a series of programs, over a decade, which our chairman will discuss shortly before we take the questions. Then we'll be sharing a recorded version of this on YouTube tomorrow. And you can also check our Facebook page to actually rewatch the live stream. Before we take questions, or before the lecturer treats the questions that he'll treat, we want our chairman to also, give us an overview of what Oasis Muslim Care Foundation does. the chairman.
Thank you very much. Bismillahirrahmanirrahim. First and foremost, I want to thank the lecturer for the very enlightening lectures that he has just delivered. Thank you very much, sir. Jazakumullah khair. Oasis Muslim Care Foundation is an Islamic organization funded by the Muslim Society of Nigeria, Ilorin Central Branch. It was funded in the year 2009, and it's as a result of issues that has to do with health of people within our surroundings that needs assistance, especially in terms of financial assistance. So since that time, we have assisted people, indigent, sick people in our society within the period going to close to 100 in number. Scores of people have benefited from financial assistance from this organization. It sponsored operation in different states. So among the core activities of this foundation is provision of, just like I've said, financial assistance to the sick, and also we sponsored public health enablement programs. In fact, the last program was our 21st edition of the public health enablement program, where we organized in conjunction with a Muslim Medical Association of Nigeria. So we provide drugs for free drugs and consultation during the course of the public enlightenment program. Also, among the program that we usually organize, a periodic program is the school health enlightenment programs that is focused on sensitizing the youth on the evil of drug abuse, drug misuse. So that has been going on for close to a decade too. And also, we have a program specifically designed for the inmates at our correctional center. So both for the adult and the juvenile home. So we have a periodic program for those category of people. So we also have an health program that we just have said for the juveniles. So this is our maiden,
Stop that.
This is our maiden edition of this webinar is going to be a periodic one. That's why we have a form that we asked the audience to fill, to tell us, to give us feedback, and as well to give their inputs on the, in terms of the frequency of the program that we're going to be having. So we are open to partnership with different organizations and society, especially that we deal with health. So on this note, I want to appreciate the doctor and promise you that inshallah this program will not be the last. In fact, within a very short time we try to update you on the next program that we're going to hold, and we will enjoin you to give us some topics, interesting topic that we feel, health topic that we feel we can as well call experts to discuss. So on this note, I want to thank everybody for the attention, for being with us since we started, and we pray Allah subhanahu wa ta'ala we grant us good health and make us successful here and the year after. Subhanahu wa ta'ala. Thank you.
Yeah, thank you, Mr. Chairman. This one Arabica is not the end of the program. We'll be taking questions, and there are quite a number of questions. So I think probably
I can see them. I think I can just go through them.
Fantastic.
So our engineer in the UK asked the question, what is the state of cancer research with respect to finding solutions? Actually, very advanced, actually. Many of these things I'm mentioning are actually due to the research. For instance, this immunotherapy is something that is really, really recent.